I'm here today to teach you the signs and symptoms that your infant may not be breathing and the technique you would need to perform CPR on them. Now what you want to do is take them out of any soft surface if they're on one and put them onto a hard surface. It could be the table, could be the ground. You want to check for a response next. You're going to clap your hands calling their name and tickle their hands and feet to get them to respond. Come on, Bubby, open your eyes. Tickle, tickle, tickle. Babies will respond if they are conscious. Call an ambulance immediately. Take your phone out. If they are unresponsive, call 000 and pop it straight onto speaker. Next, check their airway. To check an airway on an infant, you want to make sure the nose faces the sky. Their airway doesn't fully develop till they're around 1. By having nose pointing to the sky, it keeps it open. Carefully look inside their mouth to see if there's anything they've been choking on. If there's something inside, put them straight into that recovery position and carefully sweep it out. Pop them back down on their back and now check if they're breathing. To check if they're breathing, get down close. You may feel their breath on your cheek. You could hear if they're breathing. Also, pop your hand on their tummy and watch that chest rise and fall. By covering all your senses, what you're looking for is within 10 seconds, an infant is going to breathe approximately 5 to 8 times. You want to hear good breaths, not wheezing or gasping. You want to ideally see that chest fully rise and fall those 5 to 8 times. If they are not breathing, you're going to need to commence CPR. CPR in an infant, you'll need to keep that airway open by keeping that nose to sky. Carefully place one hand on their head. The other hand, you'll use 2 fingers on the center of their chest to compress. To find the center of the chest, fingers under armpits, where they meet, that's the center. Push those buttons and zippers aside, and you'll be compressing approximately 1/3 of the chest depth. 30 compressions and 2 life-saving breaths is what you'll need to do. The compressions are approximately 100 to 120 beats per minute. It's about 2 per second. If you know the Baby Shark song, you could hum along to that. It's the perfect rhythm for CPR. 30 compressions would look like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. The 2 life-saving breaths, you'll put your mouth over their mouth and nose. They're nose breathers. You want to breathe slowly and gently. You only need a little breath on an infant. Too much is dangerous. It goes into their tummy and comes out and makes them vomit. So it's just a little breath. After the 2 breaths, continue 30 compressions followed by those 2 life-saving breaths, either until your baby recovers or the ambulance arrives to take over. If they start breathing, put them straight into the recovery position. The recovery position for an infant is pistol grip along their jawline, relatively firm, arm down their body, leg closest to you over that arm and roll them forward. Keep them in that decline position. From here, you can check if there's any other injuries they may have sustained. Keep your hand on their back and around near their rib cage so you can continue to monitor their breathing whilst you wait for that ambulance. And don't panic at any time if you forget any of these steps. 000's on the phone, they're going to be your best friend. They will guide you through every step of the way and they'll do their best to keep you calm as well during that time.